some of the steps from 2 weeks ago we hope will show an impact, but really the steps, additional steps of the last 4 or 5 days won't really begin to show an impact for about 7 or 8 days more, and then really demonstrable after 2 weeks. Now why? Again, somebody catches the virus, you encounter somebody, you get it. It's usually 5 to 10 days incubation period until you develop symptoms. Usually within 5 days, but it can be 7 or 8 days. Then you're likely to get tested. Then it's another day or two until you get the results back. So that can easily be 9 or 10 days, even longer if it's asymptomatic or slower onset. And then, of course, the hospitalization numbers are also what we would call a trailing indicator. That means that they go up 2 weeks after, they would start going down 2 weeks after the changes were made. So I am confident that the steps that are being taken across our state with the counties that are now in red will help turn the corner on reducing cases and hospital load, which is now in a very critical phase with only 25 ICU beds in Denver, 3 in Weld, 5 in Pueblo, 14 in Colorado Springs, down to very low numbers of ICU beds available. Also, there's a crunch in some of these areas in the non-ICU beds too. But there is a timing factor there, and while I expect these successful data-driven interventions will work, it takes some time. So 4,150 cases today. This is a height of infection, and Dr. Herlihy will talk about this, but the state models how many people are currently contagious because they're estimating there's a 9-day window the average person is contagious. Unfortunately, usually a day or two before they get symptoms, and then a week or so after symptoms are developed, usually until those symptoms resolve for several days. The newest statistic is that 1 out of 41 Coloradans are contagious right now. That is significantly up from the prior week. It is the highest percentage of contagious Coloradans that we've ever had. So not a time to be fearful, but a time to be very cautious, because if you encounter, and you might, 40 or 50 people at the supermarket, very likely that one of them is contagious, more likely than not. Hence the importance of mask wearing, social distancing. You are unlikely to get it in an encounter where you are both masked and it is, a minute or two, like you're buying something at a store. Is it possible to contract it? Yes, but it is unlikely if both people are masked and you're only in the same vicinity for a minute or two. More likely, longer periods of time together, indoors, close proximity, 15 minutes or more, and no mask wearing, which brings me to what that often resembles, and that is a family gathering for Thanksgiving. Generally around Thanksgiving, you might have a larger group of people, 10 or 15 people, indoors, generally not mask wearing, and that is the kind of environment where it is very likely that transmission will occur. So if you are having a Thanksgiving of about 10 people from multiple households, that gives you about a 1 in 4 chance that somebody will be contagious with COVID. And in that Thanksgiving setting, there is a very high chance that will spread to others. Maybe not to all 10, maybe to 3, maybe to 5, maybe to 2, but it is very likely to be transmitted. So I think ultimately everybody has to live with your own. You have to live with their own. We have to live with their own conscience, our own responsibility. If you are hosting large get-togethers from different households with grandparents and uncles and aunts, you ultimately have your own conscience if something happens to one of them. But I want to make sure you're aware of what those risks are, in hopefully taking the advice of the CDC, of us, of health professionals, of doctors, to avoid gatherings of multiple households during Thanksgiving. My family, 4, 5 if you include Gia, our 10-year-old 10-pound terrier mix, 4 humans, 1 dog. We'll just be having Thanksgiving alone. That's very difficult because our family's a very close family. I have not been able to see my parents now in 9 months. We normally see each other 3-4 times a week. That will continue through Thanksgiving. My parents are both 76. We know that they are at much greater risk for the virus, not to mention, of course, Marlon and I don't want to get it. So we will just be having, and I'm going to have fun cooking. I'll be spending all day Thursday cooking. I'll probably cook a lot more. We'll be doing leftovers for days, but I'll be cooking just for our family of 4 plus Gia. And that's at the end of the day, that's because, of course, we care deeply about my parents. We care deeply about our own health, our kids' future, our aunts, our uncles, our cousins. Last year we had Thanksgiving with our cousins, enjoyed that very much. And we plan to do that again next year. But this is not the year for that. We simply love them too much, and they love us too much to put one another at risk. So I know families are making your decisions. That's what my family's doing. I encourage you to do the same. If you choose not to, if there's 10 people, 4 out of 5 times, you won't have a price to pay, but 1 out of 5 times you very likely will. Those are not terrific odds, and I think most people don't want to gamble with the lives of particularly their elderly family members. And again, there are additional steps. If people are getting together, we encourage people to start quarantining a week ago. Obviously, there are ways to have safer Thanksgivings. If people have been self-quarantining for a week or 2 leading up to Thanksgiving, if they get tested a day or 2 before Thanksgiving, none of those are perfect. None of those are as safe as simply having Thanksgiving with your household. But if you absolutely have to do this and get together, and there's folks who do. There's folks who, this might be your mom or dad's last year on the planet, and you want to gather together even with that risk. There are still ways to reduce that risk, and that includes, hopefully, it's too late to quarantine now, but hopefully people who are attending it have been quarantined, number 1. Number 2, mask wearing can absolutely reduce the risk. Being outdoors can absolutely reduce the risk. Those are hard to do in the family setting, but sometimes they can be done. Maybe for the social part of Thanksgiving, people wear masks and then they take them off when they eat. It's up to you. Personal responsibility, consequences. You've seen the data. You know where we are. 1 in 41. People over 70, roughly 1 in 4, 1 in 5 need hospitalization. That is a very high percentage chance of hospitalization. Overall, folks who are hospitalized, about 5% don't make it, but a higher percentage of people in their 70s and 80s don't make it than the overall 5%. So that is also dependent on age. It's not something anybody of any age wants to contract. And of course, we've lost people of all ages. We've lost 2,456 Coloradans, over 260,000 Americans, millions of people across the world. The deadly work of the virus is not yet done. There is hope on the horizon. We are just weeks away from the first vaccine dosages in our state, months away from enough vaccination to finally end all of the extra precautions that we are taking. But we are not there now. And celebrating Thanksgiving the normal way is not safe enough for my family. And I encourage you to really be thoughtful about this as well. And make sure that you have your family there for many Thanksgivings to come, and that trying to sort of force a social situation this Thanksgiving could put your future Thanksgivings at risk. And each of us will have to live with those consequences for ourselves and our family. Many of the affected Coloradans are asymptomatic. Again, while the safest thing to do is simply to gather with people of your household, another simple thing to do if there are others, anybody with any symptoms should not come to the Thanksgiving table. Fever, cough, headaches, sore throat, they should not be there. Given the level of infection, they should of course get tested, but there's a very high chance that symptoms are caused by COVID, given where we are with COVID today. And again, one of the reasons that not having Thanksgiving is the safest thing to do is because about half of the people infected are not showing symptoms. And so it could be, a 17-year-old nephew who went on a date and contracted it as asymptomatic and gives it to 6 people in the family, including grandma, grandpa, and the uncle, so that this is what happens with this virus. We are hopeful that Coloradans will make informed decisions, the best decisions for them and their family. It's a responsibility, and we all will live with the consequences. So it doesn't mean we don't celebrate. We're celebrating at home with the people we live with. We will, of course, be doing Zoom and video with the extended family. And maybe I'll even put some of the food I cook, outside our door, and they can come by and pick it up if I cook enough. And look, when you're doing that holiday shopping, there's another tradition that we're worried about coming up called Black Friday. The way that normally looks is not a smart thing to do during the pandemic. Of course, the stores are open, people can shop. I hope they're having sales, but make sure to follow those social distancing protocols at the stores, right? Avoid prolonged in-person contact with others. In some of those stores, there's definitely more than 50 people, so you know that a few of them are contagious. So please wear a mask correctly and try to avoid those. Try to have as much distance between you and other people as possible. You know that hospital capacity is our key indicator in this pandemic. We want to make sure, not just for the sake of people who contract COVID who need hospitalization, but people with any other condition that need hospitalization, heart attack, stroke, car accident, appendicitis. We want to make sure that that life-saving treatment is there for you. And our hospitals and health facilities and staff are really experiencing a lot of stress right now. 31 hospitals are anticipating staffing shortages right now, which means many nurses are working double shifts. We are starting to approach double the daily number of hospitalizations we did in spring. And we are up against, in many areas of our state, the close to the ICU capacity. So our North Star continues to be, we want to make sure that every Coloradan who needs quality health care at a hospital gets it. And it's up to all of us to do our part. And we all thank our healthcare workers who, I would add, in addition to working long hours and stressful conditions, are absolutely put themselves at risk, which is why they will be among the very first Coloradans to receive the vaccine. It's also important that folks know that the vaccine does not confer instant immunity. You don't get the shot, and the next day you can go out and contract COVID. There's no immunity the next day. There is 2 shots. It's likely that the first shot confers some immunity, but then 30 days later there's another shot, then 2 weeks after that you're immune, so that's a 45-day process. It's a slightly different with each of the drugs. Now again, there's some evidence from one of them that the first installment might confer some, not the 90%, maybe some lesser degree, but you are really not, in effect, have that high level of immunity till about a month and a half after you receive that first vaccine. So there'll be a lot more materials around the vaccine education as that's available. I think we can all very much look forward to that, and it is just a matter of a couple weeks, 2-3 weeks, until the first Coloradans are hopefully able to receive life-saving vaccine. With that, I want to turn it over to Dr. Rachel Herlihy, and then I have a couple other announcements as well around additional steps we are taking to help kids get back to school safely in the spring semester. But Dr. Herlihy.
Great. Thank you, Governor. Good afternoon. Bring up the slides, please. All right, so this figure shows you our 7-day average of COVID-19 cases occurring in the state. And so one of the things that you'll notice is that we've seen this steep increase in cases over the last couple of months, really since early September. We've really been seeing this steady increase in cases in the state. If you look at this figure, you'll see that we're near our all-time high for number of cases when you look at the 7-day average. If you look at that peak, you will notice that in the last couple of days, we have seen a little bit of a stabilization in our counts. So we have seen a little bit of a slowing of our increase in cases. It could be our earliest indication that some of the actions that Coloradans are taking are making a difference. Again, these are actions potentially a week ago, 2 weeks ago, that we're just starting to see now. Really too soon, though, to know if this is going to be a lasting trend. It's really just a couple days worth of data, and we'd like to see several more days worth of data to know if this is going to be a lasting trend. Also, when we look at that case data, we know that with the Thanksgiving holiday coming up, we could potentially see an increase in cases again. We've experienced that previously with holidays, and with Thanksgiving being primarily an indoor holiday with multi-generational gatherings potentially occurring, that does potentially set us up to see a spike in transmission in the state. And this is again why we are recommending that individuals gather just with their own household. Next slide. We are not seeing the same level of stabilization in our hospitalization data. We continue to see a steady increase in hospitalizations in the state. You can see that we've really seen steep increases in hospitalizations day over day in the state, and this is really what, as the governor mentioned, is continuing to strain our healthcare system, our healthcare workers who are working long shifts and hard shifts to make sure that all of the Coloradans that need care, whether that's for COVID-19 or other conditions, are able to receive that care in our state. Next slide. This next figure shows you hospitalization projections over the next few weeks. So if you look at the figure on the left, that is showing you nearer term projections. If you look at the figure on the right, that is showing you longer term projections. The black line in each of these figures shows you the number of hospitalizations that have occurred in Colorado over time. And then the figures in the area in the box is showing you where we see this divergence of lines, divergence of the number of potential hospitalizations in the state based on the level of transmission control we're experiencing. So if you look at the tan line, that shows you our current trajectory in the state. You'll see that there's a horizontal line drawn at 6,460. That is our estimated hospital bed surge capacity in the state. So really our maximum hospital bed capacity in the state. You'll see that on our current trajectory, that tan line, we do stay below that maximum surge capacity in the state, but if we see transmission control decrease, so back to what it was about a week or two ago, down to 60%, so a decrease of 5%, and see that trend continue, you see that we do potentially exceed our hospital capacity in the state. Conversely, if we're able to increase the amount of transmission control in the state over the next couple of weeks, you can see that we can dramatically decrease the number of hospitalizations that occur in Colorado. Next slide. The story is a little bit different when you look at our ICU capacity. So if you look at this figure, you'll see again the black line that shows you ICU admissions in the state. And then you see those three lines diverge. The tan line shows you our current trajectory. You'll see that on our current trajectory, we are projected to exceed ICU bed capacity in mid-January. And this is really why we need to increase transmission control in the state to ensure that we have sufficient ICU capacity in the state over the next couple of months. So you see if we're able to increase our transmission control in the state, we can follow that green trajectory and come, stay well below our ICU bed capacity in the state. Unfortunately, if we see that transmission control decrease, potentially a decrease associated with gatherings, less social distancing occurring around the holidays, that's when we have the potential to really significantly exceed our ICU bed capacity in the state, and that could happen in this figure as soon as mid-December. Next slide. This next figure shows you projections of COVID-19 deaths in the state. So the figure shows you, if you look at the purple line and where you see the branching from there, you'll see that we've had approximately 2,800 deaths to date in the state. You'll see that the number of deaths that occur are projected to occur by the end of the year, so by December 31st, really varies depending on how much transmission control we're able to implement in the state. If we stay on our current trajectory, that 65% transmission control level, you'll see that we have 6,600 deaths that occur by the end of the year. If we're able to decrease that, if that transmission control decreases to 60% transmission control, you'll see we have even more deaths. However, if we can reverse the trend and really improve our transmission control, improve social distancing, improve mask compliance, you'll see that we can really decrease the number of deaths that occur in Colorado by thousands. Next slide. So as we approach the Thanksgiving holiday, reminder to all Coloradans to do these three key things. First, do not gather with people you do not live with. That includes over the holiday that's coming up in just a couple of days. Wear a mask when outside of your home, and stay 6 feet away from others at all times. Thank you. Back to you, Governor.
So it's responsibility and consequences that you have to live with your family and your loved ones. I have another important announcement today. As you know, we've been very focused on kids being able to return to in-classroom instruction safely. Based on mounting evidence, we know a lot more than we knew in March. I strongly believe, based on what I've seen, it's the safest place for teachers, safest place for students is school, largely regardless of the level of outbreak in the community, because it is a safe environment, a regulated environment. People wear masks. Many schools have been back full-time the whole year. In fact, the majority of school districts, but not the majority of students. Those are many of our rural districts. But for many of our suburban and rural folks listening to this, it's been sporadic. Maybe your kid was back for a while, wasn't back. And if there's a classroom quarantine, that needs to be, of course, observed. But we are going to be more hands-on in working with teachers and school districts and schools and families to get kids back to in-person learning in January for next semester, to have a minimum number of interruptions. We're establishing a task force that will work closely with teachers and parents and principals and superintendents and elected school boards and health officials to really help move forward with the support that's needed for kids to return to safe in-classroom instruction. We're going to hold the first meeting tomorrow, looking at protocols, looking at examples of what works. We're going to work backwards from January to make sure we have a sequencing and timeline with what's needed. As you know, we pushed out $15 million just last week to help schools be able to have the additional safety protocols that they need to be able to meet. And schools are a reasonably safe place. I'm really excited to hear on-the-ground perspectives from parents and teachers and school boards about what's needed to be as safe as possible for as uninterrupted as possible of a second semester. And we're going to be very engaged working with all of the stakeholders because we know that not only do parents rely on it, but frankly, we can't let the future of our kids become yet another casualty of this pandemic. And my administration will work very closely with the Department of Education, school districts, teachers, and parents and superintendents to have a safe return to school in January for as many kids as possible. It's a challenging year for everybody. Of course, most of all for the folks who've suffered the health impacts of COVID, but also for the students, for the teachers, for the parents. We're hopeful that 2021 will provide additional certainty. As we head into holiday weekend, I want to again emphasize the importance of celebrating festivities with people who live in your own household. It's an important responsibility we have to keep our loved ones safe. Ask yourself if you can live with the consequences. 1 in 41 Coloradans currently contagious. 10 people, you got a 1 in 4 chance that somebody's contagious. In that normal Thanksgiving setting would spread to 3, 4, 5 people. The light is at the end of the tunnel. We're just weeks away from the first vaccine. It's a reason to double down, to do what we need to contain this virus. I'm grateful for my family and loved ones, even though I won't be able to be with them this Thanksgiving. I look forward to being with them virtually, and of course, most importantly, being able to be with them for Thanksgivings to come. And maybe we'll have 2 Thanksgivings next year, right? Maybe we'll do one once we're all safely vaccinated and another later next November. I'm grateful for the dedication of our healthcare workers, our first responders, but also grateful for your dedication in really being willing to take a very difficult social distancing and make it happen in our own lives. We all, if you're young and single, you want to go on dates, you want to see people, you want to go out. If you're a grandmother, you want to be with your grandkids. These are hard things to ask folks to delay. But by delaying them, we can ensure that we are able to enjoy them for many years to come. Happy Thanksgiving, Colorado. Happy to take some questions.
Hi, Governor. This is Mary Ann Goodland from Colorado Politics. I have one question for you and one question for Dr. Herlihy. Am I reading this, to Dr. Herlihy, am I reading this correctly, that the number of deaths from COVID could nearly double in the next month if at perhaps 65%? And then that's 5 weeks. That's amazing to me. For you, Governor, we still have a number of counties that are moving to red status, but have virtually no regard for actually enforcing any of the public health orders. How can people take this seriously if the state won't enforce it or the state doesn't have the mechanism for enforcing it?
Dr. Herlihy?
Sure. So unfortunately, that is the correct projection, and it really has to do with the amount of disease transmission that we are seeing right now. It's an unprecedented level. As all of you know and you saw in the figure, the amount of disease transmission that we've seen in Colorado in the last several days is really the highest it's been since the beginning of the pandemic. And at that high rate of disease transmission, we are unfortunately going to see an increasing number of deaths occur in the state. Of course, that's a lagging indicator, so it will be weeks until we see those deaths unfortunately accumulate in the state. But again, I think it reinforces our message that we have right now, that particularly at this point in time, gathering just with your own household for Thanksgiving is really an important strategy, especially to protect vulnerable Coloradans who might be at greatest risk of severe outcomes, including death.
We are hopeful that this model is an extrapolation of where we are today. This leads into the second part of your question, but with the majority of the population of the state now having the mitigation of being in a red county, the likelihood, the hope, and the informed belief is that the transmission rate will be affected and will be reduced. So do you want to comment on that real briefly?
Yeah, absolutely. So that is our goal, and that's why we're showing these projections in the model. Our goal is to get to a place of 80% transmission control. We know that that's the level we need to be at to really see a true decrease in the number of cases occurring in the state. And if we can achieve that in the next couple of weeks, that's really where we have the greatest impact on outcomes in the state.
So, look, I think it's a time for every Coloradan, and that includes county elected officials, to really ask themselves, are you on the side of the virus or are you on the side of Colorado? Now, quite clearly, no matter where you operate in the state of Colorado, you're subject to state law. And, of course, as has been the case throughout this health crisis and even before this health crisis, CDPHE licenses restaurants. We have Department of Revenue that licenses liquor stores. No matter where you are, no matter what commissioners think, liquor stores can't sell liquor to 17-year-olds. And also all the relevant health orders need to be followed. Restaurants can't have salmonella or hepatitis outbreaks without the proper protocols, and they have to operate under the proper COVID protocols. So it's no different than it's always been, regardless of the personal opinions of county commissioners around, what age should be legal for alcohol consumption or whether salmonella or hepatitis exist or not. It simply doesn't matter. These are all licensed by the state because we need consumer confidence. Whether you operate in Weld County or Sedgwick County or La Plata County or Denver, people want to know that they have reasonable safety when they go into a restaurant. And that's what those safety protocols have been there for, are there for, and will continue to be there for.
Governor, good afternoon. This is David Clue, Denver 7. This is a bit of a follow-up to Marianne's question, but this focuses on businesses that are looking to defy en masse. In Loveland, as you probably know, nearly 100 businesses now are defying the county's move from level yellow to level red, meaning they'll continue to allow indoor dining, among other things. What is the response from you? And at the end of the day, what can or will the state do about it?
Well, every business in the state of Colorado needs to follow our laws. And whether you agree with it or not, in red counties, not having indoor dining is the law of Colorado under a temporary health order. So, of course, any type of business that violates a health order, whether it's hepatitis, salmonella, or COVID, will be, could lose their license to operate at that retail outlet and lose their liquor license. That would be a devastating outcome for many small businesses, and I encourage all small businesses to implement or go above and beyond, as many have, the current baseline health requirements of the state.
Governor Steve Stager from 9 News. I want to follow up on both Marianne and David's question now. Looking at those businesses in Loveland, do we hear you correctly today that if they defy this order, that they will see their licenses at least restricted temporarily? And a second question on that, as a state, you have a lot going on right now, a lot of resources in use. Is it even useful to spend resources trying to enforce these rules when you have so many businesses looking to defy them right now?
Well, look, I think that it's always a challenge. I mean, there's, liquor stores and bars, and if they serve a 17-year-old, they lose their liquor license. There's always enforcement of state rules and laws. And as I said, even without COVID, we often have hepatitis and salmonella to deal with on the restaurant side. Now, on top of that, we have COVID associated with social proximity, not associated with food preparation, but associated with physical proximity of customers. And of course, our businesses will, continue to follow the law, and it's always the case that serving 17-year-olds or illegally seating people or not removing people who have hepatitis from the kitchen. These always happens in the routine course of business that restaurants can temporarily lose their license, because it's really important that we keep consumer confidence in places being safe, and we don't want a few bad actors undermining that for the restaurant industry, especially at a time when I have called our state legislature to step up to help the good actors in the restaurant industry. And this is really unprecedented in Colorado, over $100 million really to be able to go out to help our restaurants get through a very difficult winter. And we don't want that to be undermined by just a few bad actors.
Hi, Governor. Stephen Tubbs, KNUS. I want to play devil's advocate if I can. And you've said a couple of times you have your own conscience when talking with Coloradans. I'm wondering if you have thought, wow, what if I should have shut down the state? I mean, we're talking about a holiday unlike the 4th of July, where a lot of elderly will be involved. People are still saying, I'm going over to grandmother's house. I'm wondering if you've thought about, God, am I making the right decision right now to keep this state open, or maybe leveling it out and putting it up at level purple? Thank you.
Look, I'm cautioning in the strongest possible terms that people should celebrate Thanksgiving with people in their own household. I'm doing that myself. Doctors are advising that. Dr. Fauci's advised that. CDC has recommended against travel. At the end of the day, there's no ability of any state or the federal government to monitor, nor should there be, what people are doing with Thanksgiving. That's why it's ultimately a matter of personal responsibility, but it's one that people will have to live with the consequences. And I'm hopeful that when they see that if you have 10 people over for Thanksgiving, there's a 1 in 5 chance that you're inviting COVID into your home, and in that scenario, it likely will spread to 3, 4, or 5 people from one, that will be a stark warning to people to do the right thing. We are, of course, coupling that with additional health precautions in the red counties, like ceasing in restaurant dining, further reductions in gym capacity, making sure that offices encourage telecommuting where they can, and have people come in where they need to. So this is a challenge across the board. It's the health challenge. It's a social challenge. It's a psychological challenge. It's an economic challenge. People value those things differently. They're all valid points. But we need to have a cohesive statewide response that really accounts for all of those factors, and we do.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión Colorado. Gobernador, ya existen 3 posibles vacunas de COVID-19, pero se ha generado una controversia sobre por qué los mayores de 65 años y el resto de la población deben recibir la vacuna luego de los presos que están en las cárceles. ¿Por qué tomó esta decisión y cuándo tendrían acceso a la vacuna las personas en Colorado?
Otra vez, por favor, repítelo, por favor.
Ya existen 3 posibles vacunas de COVID-19.
Sí.
Y se ha generado una controversia sobre por qué los mayores de 65 años y el resto de la población deben recibirla luego de los presos que están en las cárceles.
Ya. No, yo creo que gente en la población general mayor que 65 años deben recibirlo antes de personas en las jaulas, ¿cómo se dice? ¿Sí? Cárceles. Personas libres deben recibirlo antes de personas en cárceles. Y el virus es más peligroso para personas mayor que 60 años y vamos a vacunar a los viejos inmediatamente cuando recibimos el vaccino. Next. Go ahead, yeah. No? Connor?
Governor,
Go ahead.
this is Andrea Dukakis
Hi,
from
Andrea.
Colorado Public Radio. Hi. This is a 2-part question. Dr. Herlihy talked about total hospital bed capacity and what that means. I understand you have the ability to transfer
Yes.
patients from one hospital to another. And I wonder if that includes, so this total hospital bed capacity, the ability to transfer, say, an ICU patient to one hospital and a non-ICU patient to another. And then the second question is, what will you do? What levers do you have to pull if, in fact, we do meet total capacity?
I'll let Dr. Herlihy address the first one.
Yes, thank you for the question. So absolutely, the plans around this coordination of transfers in the state really is to ensure that patients are able to receive the level of care they need. So that may mean, if a patient needs an ICU bed, there's not one available at the hospital where they currently are, having that patient transfer to a hospital where an ICU bed would be available. There's also the possibility of hospital beds, general medical, surgical hospital beds being converted to ICU beds as needed. So that's certainly another possibility to ensure we have capacity in the state.
And then as we talk about the order of operations, we have the regular hospital capacity, the surge hospital capacity. Then we also have the alternative care sites. Those are non-ICU sites, but they can free up non-ICU beds to be converted to ICU beds on premise at hospitals if needed. We have not yet activated those sites. We have activated additional staffing, but we are monitoring the data daily to see if the activation of any of those alternative care sites are needed in Pueblo, Westminster, and Denver.
Hello, Governor and Dr. Herlihy. Can you hear me okay now?
Yes, we can.
Okay, very good. Your office yesterday released a little bit of information that Colorado is going to take part in a test regarding the delivery of the vaccine. Can each of you tell me a little bit more about this, and if by taking part in this test, this will give Colorado a head start in the delivery of the vaccine once it becomes available?
I'll let Dr. Herlihy address the specifics, but I'll just say generally we're very excited about this because it will enable us to have a dry run of what happens when we receive the vaccine and get it out just a couple weeks or so ahead of the real vaccine that we expect. So we're very excited, increased preparation. We're excited to be selected as one of just a small number of states to actually have this pilot run through. Dr. Herlihy?
Thank you. So as the governor mentioned, there's clearly lots of moving parts to make sure that we get this vaccine out as efficiently as possible once it's available in the state. And so Colorado is fortunate to be taking part of this pilot to really be able to test our systems, to learn from areas where we identify potential lack of efficiency, and really to maximize our efforts and make sure that we're ready when the time comes.
Hi, Governor. Taylor Summers for NBC News Radio in Denver. I was education, like you, is on top of my mind going into January, and one of the questions I had to do with high schools. Some high schools this year faced shutdowns because they did not have enough staff members to watch over their students because the staff was in quarantine for COVID-19 while the students were not. What are some solutions that the state is looking at to address that kind of shortfall as we begin the upcoming semester?
Well, we're going to focus our new back-to-school task force, which will meet for the first time tomorrow, on how we can have, to the best extent possible, uninterrupted in-person education for kids of all grade levels next semester. Now, that's easier for K-8, a little harder for high school, simply because of the way schedules work, meaning when there is a case or an outbreak, often a teacher might encounter over the course of a day, hundreds of students rather than just a class of 20 or 25 or 30, which might be more the norm for an elementary school teacher. So it is harder to keep the staffing we need at high schools. Doesn't mean we should ever back away from it. We should. Some high schools are doing hybrid, which is also a way of reducing that risk. But certainly that'll be a big focus for our back-to-school task force, including teachers, school board members, health officials, which will meet tomorrow.
Hi, Dr. Herlihy. Mo Clark here with Colorado Newsline. I have a two-part question. First, with the state's largest outbreaks occurring in Colorado jails and prisons, I'm wondering if the current strategy of targeted and surveillance testing is the most effective strategy to getting these outbreaks under control and stopping transmission. And second question, how is the state health department providing oversight to facilities that have been unable to get their outbreaks under control?
Thank you for the question. So I would say that we really need layered strategies for outbreaks of all types, and that absolutely applies to outbreaks that are occurring in correctional settings, so whether that's jails or prisons. There's multiple strategies we need. Certainly testing is going to be an important component of, limiting introduction of virus into the facility, and then quickly identifying when virus is present in the facility, whether that's in staff or among residents of the facility, but also, using infection control practices, cohorting strategies. All of these things are really important strategies that facilities you need to have in place to ensure that transmission is limited as much as possible in these facilities. We continue to work closely with state and county level facilities together with our local public health partners to make sure that they have the best access to information, testing strategies, protocols to really protect all Coloradans, including those that are incarcerated in the state.
Hi, Governor. This is Alex Burness with the Denver Post. The White House has downplayed the severity of this virus consistently and declined to model safe behaviors as it relates to COVID. There are many elected officials in Colorado who've done the same. Contact tracing is incomplete at best. It's hard for many to get a test these days and much harder to get a rapid test. There's no new economic stimulus, which forces more and more people to have to keep going to work in dangerous settings. With all that said, do you think it's possible you've overweighted failures of personal responsibility as the reason for many of our current negative trends as opposed to these many other system-wide failures?
There's a lot of national system-wide failures with regard to our coronavirus response. I don't think it's any accident that America has among the highest case rate and fatality rate per capita of nearly every nation. Greater economic interruptions because of the failure to deal with this on the front end and the failure to deal with it nationally. While testing has scaled up, and we celebrate that, it is still across the entire country sporadic. Supplies have been sporadic. The soapbox of the White House has been, at best, sporadic in sound health advice. For instance, the CDC has advised that people don't travel for Thanksgiving. I've certainly encouraged families to celebrate Thanksgiving with people in their own household. The President of the United States has, as far as I know, yet to encourage the safe celebration of one of our most important national holidays in a way that will save lives. America should do better on the economic response. The first round, I give us an A minus. PPP, $1,200 to people. Those were generally the right things. Congress came together, Republicans, Democrats. It bought us the space as a state to have an extreme mitigation phase without people losing their homes and losing their economic security. It worked fairly well. But then it's like Congress and the president forgot about it, and there's blame on both sides. It's not like Congress has passed something that the president is vetoing or hasn't signed. It takes all three: the House, the Senate, the president. They need to work together now to provide economic relief, direct payments, unemployment insurance, aid to affected businesses that will help states have the ability to get the virus under control. Without asking families to lose every ounce of security that they have.
Hi, Faith Miller with Colorado Newsline. I have a question for Dr. Herlihy. So Crowley County has said it's not required to move to red because it can leave the prison outbreaks out of its incidence rate calculations. Could you explain the reason for calculating it that way to determine the dial level, and is that happening everywhere in the state? Thanks.
Thank you. So when we look at counting cases for the dial, we do exclude cases that are occurring among individuals who are not regularly interacting with other members of the broader community in that particular county. So excluding cases among individuals that are living within a prison would be part of that protocol for doing that calculation. We do, however, include staff who would work at the facility during the day, but then go home and be out in the community during the day or in the evening when they're not at work. So that's really how we do it. We take a look at residents of facilities that are really not coming to and from that facility.
Thank you all for joining us, and on behalf of the state of Colorado, I want to wish everybody a happy and safe Thanksgiving.